Our first question is, this is from a patient. Is it safe to me to be intimate or have sex while I'm ventilated? And what kind of intimacy is realistic? And are there some practical things that could help? And she writes in brackets, or he writes in brackets, like different positions, aids, or using lubricants. So I thought we'd probably start with Nick with this question, please.
Hi. Well, I think in short, the answer is yes, it is practical that you can be intimate and have sex when you're a ventilation user. And we'll talk about various things over the next, say, 45 minutes. Um, I guess coming at it from a slightly medical, you forgive me for doing that as a doctor, a slightly medical perspective, that there are some helpful and practical, easy things that you can do or you can think about that might help somebody be intimate or have sex while they're using a ventilator. So an example might be something like talking to your ventilation team about use of a nasal mask so that you can talk, that you can kiss, that you can have oral sex, these types of things. Um, Longer tubing so that the ventilator can be a little bit further away than where it normally is. Um, and that can be relatively helpful. And it sounds like maybe an unusual thing to say, but if you have humidifier, taking the humidifier out temporarily, just so that if anything gets knocked over, you've not flooded your ventilator with water and are panicking about that. There are some different positions as well that can be helpful, and Charlie might have, as a physio, better kind of conversation to say about that. But there are absolutely things to do. One of the things that we do in Newcastle with some of our patients is some of our ventilators have a more than one profile. So you can have a kind of profile, which is what you use day to day. And then sometimes people have a profile for if they've got chest infection, for example, their settings might be different. Well, you could talk to ventilation teams about having, for example, a sex profile in which some of the alarms might be disabled. It's not something you'd want to stay on permanently, but where the alarms are disabled, and so you're able to be intimate, have sex without having to constantly worry about the silencing the alarms or those getting in the way. Another thing is, I guess, about taking it relatively easy, taking breaks. Um, and sometimes planning breaks into intimacy so that you can get your breath back and yeah.
Thank you.
I don't know
Charlie,
if
have you
you
got
anything
any?
to say, Charlie.
Yeah, Charlie,
Yeah,
anything to add?
thank you. So, from a physio perspective, we want to be looking at optimizing ventilation, but also managing fatigue. So, I think when we're looking at positions, side lying is really beneficial because what that does, it kind of offloads your respiratory muscles by giving an opportunity to ventilate posteriorly, which means that's a larger surface area for better gas exchange. It also means that gravity assists by just allowing your abdominal content just to kind of get out the way, so you can also then distend your diaphragm to really offload your respiratory muscles. And because you're inside lying, you're fully supported by the bed. So again, you're kind of the demand on your muscles is kind of reduced. So that really helps with fatigue. The same can kind of be said for three-quarter supine lying. So you can use pillows to support. So again, you're just offloading all your muscles to reduce that work of breathing. But again, it just allows opportunity to not restrict your chest or your abdomen. So your diaphragm can fully distend, which helps kind of improve your your functional residual capacity, which really helps breathlessness and breathing. So those two positions are really helpful. I think from a side lying point of view, if you have a tracheostomy, you have to just be aware of it, that you fully support the tracheostomy. That can be with flexible catheter mounts and stuff like that, and supporting with a pillow. So just being mindful of that. But again, I think Nick kind of touched on it. It's also thinking about pacing. So having a way that you're communicating with your partner when you just need a pause. So just thinking about that. I think also a really useful tip is looking at what time of day is useful for you. So when your fatigue levels are at the highest and kind of planning around that. So just managing your overall fatigue. And those tend to be quite helpful tips. And I know Nick's just kind of touched on having things like longer tubings, bigger parameters in your alarm setting, alarm volumes and things like that. They're also really practical tips that you can use.
I'm going to ask a question about three-quarter supine lying because I think probably there might be patients who might not know what that means. So can you visualize that for us and kind of give us some examples of where to put pillows? And then after that, I was wondering, Trudy, one of the questions that the patient also added was about using aids or using lubricants. Can you give us some advice about what aids or what lubricants might support with a fatigue and a pacing element? Thank you.
So from a three-quarters lying, you're thinking about your body being about 45-degree angle. So you're on your back with 45 degrees, and you can have pillows wherever that make you feel comfortable. You could have them in a V-shaped position behind you. You could have them supporting your upper limbs. Again, if it feels comfortable, having one underneath the knees, just something where you feel completely supported, but that 45-degree angle just allows enough opportunity to relax your abdomen. And again, you're not restricted from your chest or your abdomen, and just allows that diaphragm to kind of just descend naturally.
Thank you. That's great. Trudy, anything extra we can talk about aids to support pacing and to support, making it a comfortable experience?
Yeah, one of the things I'd like to say is if we just backtrack slightly, I think everything Charlie and Nick said, absolutely brilliant. It's exactly what I'd be suggesting for my patients when I've seen them in the clinic or in these sort of scenarios, is that for some couples, they may not have been intimate for quite a long time and they're quite scared about that. So even just being sex positive, encouraging them to have quality time together as well, where healthcare professionals might not be around, or family members that are all trying to be helpful, but actually the couple probably just want space for themselves and be able to create that atmosphere. So I would encourage couples to start even just holding hands together, maybe some nice eye contact, if it is possible to kiss, how that kiss might be. I think, as Charlie mentioned about the position, so being on your side, that spoon position can actually be really intimate. If the partner is cuddled up sort of behind them, you can kiss around the neck, stroke on the back, maybe just holding the hair, stroking their arms. You can still get to chest or breasts, things like that as well. In terms of lubricants, I'll not mention the name of it, but we don't want sticky gel type. That would be the most commonly used in the NHS, but what we want is nice products. So the Yes company, who are very generous at giving out samples, so their website is called Yes, which I think is a great name for a wonderful lubricant, is that they do a oil-based and a water-based, and if you mix the two together, it makes it more slippy and slidey, really comfortable. It's also organic as well, so you're much less likely to get any kind of negative reaction, no stinging, no burning, very natural to use, feels really nice on the skin for both men and women. And they also produce an anal lubrication, so if somebody is wanting to experience anal sex, again, that will make everything much more comfortable for them as well. I think in scenarios like this, it's quite nice to use a vibration as well. So vibrators, which they don't all have to be phallic shaped. They're not necessarily to be used internally, but externally, could even use them on different parts of the body. Makes arousal a lot easier, a lot faster to enable that to happen. You can start very slow until you get used to that sort of feel, then turn it up as you would want to get an experience that you would feel. But I think also to create the atmosphere, because there will be medical equipment, we can't change that. But what we could do is add in nicer cushions, so maybe nicer fabric or colours, so like maybe velvet or whatever colours makes you feel nice, whether that's dark or pastels, and again, lighting, just dimming the lighting slightly. Lighting candles, obviously we don't want to set fire to anybody, but you can now buy battery remote controlled coloured candles, nice smells in the room, so it doesn't feel as medical. So I encourage my couples to plan ahead. And some people say, oh, we don't want to plan to have sex, it doesn't feel very spontaneous. But one of the nice things about planning is when it's a boring Monday and you think, oh, we've got a hot date on Wednesday afternoon, no visitors, no medical staff coming round, we're going to create that atmosphere and we're going to be a couple again. We're not going to be patient and carer. We're going to be a couple and we're going to shelve all of that and we're going to create that atmosphere and feel good when we're in it. And we're going to be our intimate selves that we want to be. So I think if you get those basics right, I think is just as important. And for the medical staff, I would be encouraging them to say to clients, would you like us to look at your week ahead and think where you could have some private time? So people don't even have to say the word sex, but time to just be a couple where you're not this patient and carer or there's nobody coming round, you've got space for privacy, whatever you might want to do in that time. So I think even if staff were sex positive in that way by mentioning the topic, even if they feel a bit uncomfortable about saying the word sex, it's just raising it of, we think this is important for you, gives the patient, the client, the permission to say, that would be lovely. Yeah.
Absolutely agree. And I think what's really important there is it also allows for pacing and it also allows for it to be part of the weekly plan. So if you've planned it and you've thought about it, then you can plan how much energy you've got to do all the other things that you've got to do that day. And I think scheduling it can feel tricky. And I think when you're having to have that scheduling conversation with more than just your partner, that can also feel embarrassing, can't it? So I think maybe it's about, as a healthcare professional team, saying to patients, how are you and your partner having intimate relationships? Is there anything we can do to support that? Is there any timing issues? Is there any equipment issues? Can we get you any extra extensions for bits of equipment? All that kind of stuff. I think having that conversation is really important.